Are you experiencing brain fog? Is your primary care doctor giving you answers? Stay tuned today and learn about the effects of testosterone on the brain and the effects of low testosterone in the brain. And it may be more complex than you think. And stay tuned to the end because we have some special out-of-the-box treatments we want to share with you. Welcome to the podcast with me, your host, Dr. Debra Durst, and back by popular demand because it's been a hot moment is my co-host.
Hey guys, Faraday Goli, nurse practitioner here at Revitalize MD, and today we have a fun podcast talking about the effects of testosterone on the brain.
One of our favorite topics because we hear it every day, all day long, from men and from women. I'm just not thinking as clearly. Brain fog seems to be a top complaint, right?
That's it. And memory as well. Decreased memory. Can't remember what I walked into a room for. How many times have you walked into a room and gone, why am I here?
Can't think of the word. Like just word loss, you can't, and it could be just simple things, again, zest, forgetfulness that's even more, minor, but it's bothersome as we get older because we think it's staying. We think it's not going anywhere.
Or that there's no solution or option.
Correct.
We're stuck with it.
I know. So we looked at some studies of actual testosterone and the effects it has on the brain. And there are obviously some gender differences, which I don't think anybody is going to be too surprised about, right? So what are they? So two big things, and I think this was not too surprising to us.
No, it makes perfect sense once you hear it.
There's more spatial skills. And so that area of the brain, different areas of the brain are stronger for men and for women. And obviously there's different levels of testosterone, even though we both have an abundant amount of testosterone circulating in our body. That spatial skills are stronger for men, and
with women, we have better verbal communication.
Yes.
Go figure.
I know. So this is not too surprising, but those are just little gender differences. But what we did find is that when you're looking at effects of testosterone on the brain and studies related to men and women, that there's improvement in both in cognitive decline,
memory,
and mood, and
depression.
Yeah, so there's actually quite a few studies that will support depression and improvement in mood and outlook and zest for life with androgen optimization. So
even brain structure, actual changes to the brain itself, which I thought was really, really interesting when looking up information for this podcast.
So the synapses, for instance, like, again, you hear all kinds of myths, and I don't know that we hear a lot related to testosterone and adverse effects on the brain. You hear some of those myths when it comes to cardiovascular, cholesterol panels, and prostate and cancers, but brain, you don't really hear too much about, I think. And
you really don't.
So we don't hear a lot of myths, but we also don't hear how neuroprotective it is. And so I think if we think about what happens as we age in general, we are aging, our hormones are declining, and we get inflammation in the body and in the brain, and we get decline of certain functions, and synapses and connections in the brain are one of those things that decline with age. So there are some studies that will actually support that those synapses are maintained with androgen supplementation or optimization. So, and definitely it's there for men and supportive, but it also is there for women as well.
And I think that's really important to remember is that testosterone is just not for men. It is also for women, even though our levels need to be a lot lower than your levels. Correct. We both have testosterone. We both need it maintained, especially for cognitive function, attention, memory, all these things that Dr. Durst was just outlining.
And I think that the reason that we bring this up in particular is so the things that we start to experience as we get older and we go to the doctor and we're talking about a cognitive decline. And some people will be concerned that they actually have dementia or Alzheimer's.
Yeah, especially if it runs in their family.
Yeah.
My mom had it. My dad had it. Does this mean that I'm experiencing early onset?
They'll think it's definitely, a genetic cause. But in fact, we don't look at the fact that it could be hormones. And let's talk about normal levels for a moment. So how many times do you go to the doctor, or we hear it every day? Well, I went to my doctor, but my levels were normal. So what does that exactly mean? And we've talked about this before. So normal levels just mean that there's a range and you're within the normal range. But if that range is, say, 260 to 960 or around there, that you could have been 900 and now you're 300. And is that really normal? It's not optimal for sure.
And that's a really important point there, is where you were at when you were in your 30s, 40s, and 50s is very different in your 60s and 70s, but yet that range applies to all ages.
When they say you look normal, testosterone is definitely not the issue, and yet testosterone may still be the issue. And androgens, do play a role in that neuroprotection as we get older. So decreasing neuroinflammation as we get older, and synapse, maintenance, and also synapse for cognition and memory, which might be located in the hippocampus, but also prefrontal cortex. So those are definitely things you may not hear from your primary care doctor.
So pretty much what she's saying, guys, is that when you fix our testosterone, we're going to talk more. Yeah. And you're going to get better at building things.
Well, this is true. So that's the thing. We do, what she brings up is a good point, is that we have a need for testosterone. And, the twisted view, which would be expected, is that we have a need for testosterone. It's the most circulating, abundant hormone in our bodies as well. And so when we optimize it, we may get better at our verbal skills. So it may improve our sex drive, but then you may have to
talk to us after.
Yeah,
sorry.
Yeah. Or even just listen to us during. Who knows?
Or that.
So, yeah, it's a possibility. But definitely women and men need it. But it's not something you hear from the primary care doctors. And when patients come in, frequently it's a complaint, definitely for women. And sometimes they don't even think about that being caused by a hormone deficiency.
And it's not testosterone is a one and all done fix all. There are other hormones that may be playing a role in this as well. And we'll do another podcast specifically on estrogen. So definitely stay tuned and listen to that one as well. But testosterone definitely can be playing a role.
And there's studies that show you the neuroprotective effects of androgens on the brain. And so that's what we wanted to bring to light here, is that there are studies to support that protection. And there aren't studies to show that there are damaging effects of testosterone. And again, like
on
we
the
said,
brain. Exactly.
Yeah, and like we said, we've never really heard that myth. But you do get the myth of, do women really need it? Because
absolutely we do. And I will say that 100 times over.
Yes. Well, we do treat a lot of women, and a lot of women with hormones. And so we listen and talk and communicate with women all day long. And it's actually, it's emotional for both sides, for us and for them, because they get no answers. They're tearful by the time somebody listens to them. And so they need those options.
But it's also frustrating for men. I'm the devil's advocate here. I saw a gentleman recently that was seeing his primary care and getting testosterone once a month. A once a month injection. That is a disservice, in my opinion.
Correct.
Because you feel good for what? 3, 4, maybe 5 days. And then you're already on the decline of that injection.
For the rest of the 3
For the
weeks.
rest of that month.
Yeah.
We often see guys getting injections once every 2 weeks. Again, that frustration is very apparent in our office for men as well. True. Because they feel good. They get a taste of what it's like to have their confidence, to have that memory, to clear up that brain fog, just to fall right back in to that same slump again.
Correct.
Waiting for that next injection to feel normalized. Again, yo-yoing hormones is never healthy, just like having low hormones isn't healthy.
Correct. And it actually puts you at risk for higher side effects potentially, because as you peak, and I have had some doing double the amount every 2 weeks. So then they're actually doing double what we would do even if it was a week. and they'll really peak and then they come down. And so those fluctuations are what drive side effects and conversions to other things and stronger metabolites. So definitely I agree. And I don't even think it's devil's advocate, because we are actually an advocate for both men and women, because we know how much each one of them need. It's just that there is a gender bias for the offering right now. That's
exactly.
the biggest
That's
thing.
where I meant devil's advocate.
Correct.
Is that because
Yeah.
any guy really just about can talk to primary
Correct.
or urology or go to a low T clinic and get treatment.
Correct. Yeah.
If you're willing to pay out of pocket, if you're not below that 264, but you can go and get treatment, where women are stuck.
Correct.
So the frustration for women is, I have seen everyone says I'm normal. I do not feel normal. Something is wrong.
I can't wait to feel like myself again. Yes. And so again, we have a ton of comments on the YouTube videos and on the podcast that are just talking about, anyone in our area that does this, how do we know, how do we get our hormones checked? I didn't know, I've been told this is normal. So there's a lot of, again, women going without, and that's where I think the key is that women need it too. This makes it obvious. And any woman that's experiencing brain fog, that's why we wanted to do this video, is because there's positive effects of the brain with testosterone that's optimized. And as it declines, you feel those effects. So is there anything else we need to cover?
What about peptides? We talked about some special alternatives.
Yes. Yeah. So there are 2 peptides that, again, we have been entertaining for cognitive improvement, and Cmax and Selank are the 2 that we are looking and currently implementing in the office. And again,
it's pretty exciting right now.
Super exciting.
Dr. Durst, do you want to dive into the difference between the 2 and when you're utilizing them?
So the big thing, even with peptides, in case you're unaware, and we talk a lot about peptides in other videos, but peptides is a progressive area of medicine. So peptides are amino acid sequences that basically are giving the body back what it needs to simulate neurotransmitters or hormones in the body. So Selank and Semax are 2 peptides, and again, neuroregenerative peptides that we really haven't used a lot, but both of them can be used in mood, depression, mood stabilizing, but also in cognitive and learning. So if you're actually learning new skills, even ADD, and there's some strengths of each one. So we're trying both, in different aspects. Usually we'll kind of use them in patients that have wanted some peptide use, and a lot of them actually have remyelination, not these 2 specifically, but can be used in Alzheimer's and dementia and spinal cord injury and brain injury.
So maybe we should do a podcast on that.
Oh, neuroregenerative peptides. I think that's
so
a great
watch
idea.
out for that one. That one's coming now.
That one's coming. But these 2, Selank and Semax, and again, I think Selank is a focus of, maybe they both have mood and they both have learning and cognitive improvement, but I think maybe Semax maybe more emotional support than the Selank, more cognitive. But
mental clarity.
The jury's still out right now. So we are experiencing some. Well, we're trying them. We try them in the office as staff, and then we also have patients that are on them because of improvements that they want to see. So stay tuned, because we are going to do a neuroregenerative peptide podcast as soon as we get all the information. So again, leave us comments, and if you've had any experience with Selank or Semax, please let us know, and we're willing to deep dive into anything sexual wellness or wellness. Thank you.
Thank you.